Hello, I'm Eric Topol, Editor-in-Chief of Medscape, and I'm really thrilled to have the opportunity to speak with Hala Durrah today. I only got to know Hala through a remarkable work essay that she wrote for Health Affairs back in March. And Hala, I want to welcome you to our program.
Thank you for having me.
No, it's a real pleasure and important, really critical topic. Your essay was "My Child is Sick. Don't call her a consumer." There's so much to learn here for the Medscape folks. And I want to just open it up to you. Maybe you can tell us a little bit about your background and your family.
Sure. So I am a patient family engagement consultant by profession currently, which basically means I work with healthcare organizations and systems around the concept of patient family engagement, which could span anywhere from patient-centered measurement to quality improvement, and so on and so forth. I came to the work, though, not as not in any of my plans, but by fate and destiny, I guess you can call it. My firstborn, whose name is Aya, she was born with a very rare liver disease, which we knew subsequently would require liver transplantation. And so, as you can imagine, she's now 16 years old. We've been on quite a journey in the healthcare system. In addition, I have four other children in addition to Aya,
Oh,
and
I
my
didn't know about that. Wow.
yes. And my husband is an adult medical hospitalist at a major academic center on the East Coast. So healthcare is a lot of pieces of our lives. And I realized a few years into the journey with my daughter that I really wanted to become more engaged in improving healthcare and partnering with the care team, with our physicians and nurses and pharmacists, and the larger group of specialists that she was seeing on a regular basis. So I had the opportunity to volunteer at a local hospital who was looking for more patient family involvement in some of their quality improvement work. And then from there, I decided that this was definitely something I wanted to pursue further. And I did. But obviously, along the way, my daughter's healthcare journey continues.
Right.
And I get to continue to see the good, the not so good, and everything in between. In addition, I think I have a unique perspective because my husband is also a physician and works in the hospital setting. So I understand and can empathize with the real challenges and the workflow that is constantly placing pressure on them
Right.
as physicians
Yeah.
and demands of their time. So I am very cognizant of that. So in my work, I really try to balance the voice of the patient or caregiver and the voice of the physician or nurse, because I can definitely see all the different perspectives. And at the end of the day, I think we all really want the same thing, which is, having these meaningful relationships where we communicate with one another and we can empathize. And at the same time, we all want the best care for each other.
Sure.
So that's really my goal in the work that I've been doing the last several years.
Oh, that's terrific. You have a panoramic view, really, of the healthcare
Absolutely.
landscape, that's for sure. Well, I want to go back to your daughter, who is the subject of what you wrote about. And I don't know how, I mean, it is a miracle story in so many respects. But her name means sign from God. Is that right?
Yes, her name in Arabic means sign of God. We named her that before I knew that
Right.
she was going to be born with this illness. And
Right.
it's pretty remarkable that she's really fit that name and the meaning of her name since she was born. When she did have her liver transplant, unfortunately, that first transplant failed within the first 24 hours. And as you all know, and as your audience knows, a liver doesn't wait. And
Right.
so we basically were prepared to say goodbye to her when she was about 5 years old. And subsequently, by miracle, she did get another liver 2 days later.
Yeah, it's
And
amazing.
It was pretty amazing, and it was from the same hospital where she was at, which was even more amazing because her surgeons were prepared to travel anywhere to get another liver. She was actually placed #1 on the nationwide listing after that first transplant failed.
And
So
then,
it's remarkable that she got another one.
right. So after she gets through these 2 liver transplants at age 5, then she gets a Burkitt's lymphoma. I mean, this is,
Yes.
and is that related to the therapies that she had to get
Yes.
transplant?
Yes. And she also was EBV positive, Epstein-Barr
Mhm.
virus positive. And sorry if I translate, I'm so used to trying to translate also for patients and caregivers. So I want to make sure anyone watching the interview can
Right.
understand all the jargon that comes with this. But yes, unfortunately, because of her therapies and with the combination of the EBV, she did develop stage 3 Burkitt's lymphoma 2 years after the liver transplant, which
So,
was quite devastating to say the least.
and then it required another type of transplant, a bone marrow transplant, right?
Yes, yes. Unfortunately, she had several months of chemotherapy, a pretty intense chemotherapy regimen that ultimately failed. And we had to move to an autologous bone marrow transplant. She was not able to have, donor cells because of the fact she was already an organ transplant. So, she sat one day in the hospital with a catheter, and they took her stem cells and then gave them back to her about a month later after some more intense chemotherapy. So, she's been through obviously quite a bit, and there's a lot that goes along with being a patient of liver disease or a patient who survived cancer and all the chemotherapy. So, her health, while stable, there's a lot of things that are constantly moving in the background that we're watching. I tell people I sometimes look at it like a radar screen. You kind of see the little red dots bleeping, and some of them get brighter and some of them get dimmer.
Mm,
And it's a lot of people monitoring those lights. But I'm the chief monitor of
right.
all those lights and the coordinator of making sure we stay on top of those.
Right. Well, what a quite an advocate, and just the whole thing is just an amazing story. And now I want to get into this message that you have about using the term consumer, because this is a term that I have hated for years. As it turns out, we have something in common.
Yes.
And why do we use this term when we're talking about patients in the health world? And so you wrote, I share our story because I am becoming increasingly troubled by a trend in healthcare toward thinking of us as consumers. So tell us a bit about this objection of this term, because I think if anybody has a right to object to the use of that term, it would be you. So maybe you can amplify your thoughts about that.
Sure. The term definitely doesn't resonate with me, and I share your strong feelings against the utilization of this term. Overall, I think it continues to underline and push the business imperative of healthcare versus the humanity imperative in which healthcare was initially built upon.
Hmm.
So I I reject in some ways this notion of consumerism will improve healthcare, because healthcare did not start as a business imperative, nor was the framework built to support such a term. I believe that physicians and nurses, particularly in all the experiences we've had in healthcare, I don't think they'd ever define my daughter as a consumer. It really gives, I believe it distances from one another and doesn't really amplify or support that relationship-based care that we all really seek to have and to improve. I also don't think consumer really, although I understand why some believe it may, I don't think it empowers us. And the reasons being that the framework of healthcare is not set up in such a way where consumer denotes choice. A lot of healthcare is dictated to the patient or to the caregivers by their insurance companies or their lack thereof, or the communities in which they live, or by lots of different other parties that are involved in it. So I'm not quite sure where the choice comes in, especially the ultimate choices, which no one chooses to be sick. That
Right.
is not something anyone wants to choose, and a consumer has choices, but we don't have that choice. So I kind of find it, um, I find it that it doesn't make sense to use that term. And I understand where people come from in terms of wanting to empower individuals by changing the terminology of the passive quote unquote role of the patient. But I'm not quite sure it makes us equals or gives us any more choices or improves the care we will receive by changing the terminology in which we use.
Well, words are important, and this term is used, it's hackneyed, it's pervasive. And you, I think, made the most eloquent case in the history of the medical literature
Oh
against
my
the term
gosh.
of
I'm
consumer.
humbled by that. I'm not sure if I deserve all that, but I
No,
appreciate it.
I really do believe that. I mean, you have the basis for that. Your intersection with the medical world, healthcare world is extensive. Now, you have a background. You have a master's degree from George Washington, I think,
Correct.
and you worked in tourism, and you made some interesting parallels between a consumer of tourism versus a patient. Can you talk to us about that?
Sure. So, yeah, my master's is in tourism administration with a focus in meeting and event management. And here I am in healthcare advocacy now. But I found that
Big
it's been
switch, yeah.
very, yeah, it's been very useful because you do see in healthcare this shift of trying to create a tourism type experience for healthcare. And tourism, generally speaking, is number one, a choice. We all choose to travel or choose to use a certain hotel or choose to use a certain rental car company because we've had great experiences. And then most of the time you come back from a vacation, not always, but most of the time, having great memories to share with others. And when you share with those with others, they may want to do the same experiences as you do. But in healthcare, I don't believe that we can really equate it to a vacation. I'm not quite sure who would utilize that same experience as a vacation. And I think there's one thing that healthcare has that no other industry has, which is the trauma, the pain, the anguish that goes into being either a patient or the caregiver of someone, and vice versa. I mean, I think for physicians and nurses too, there is a lot of emotions involved in the healthcare experience that you could never find in tourism. And tourism does have, this constant feedback loop that they try to have with their customers or consumers. Healthcare does not. Yes, we tout these wonderful surveys that are supposed to increase patient satisfaction, but if you look at those surveys, were any of them co-designed with the communities in which those health systems serve? The answer is no. Do they allow you to really respond in such a way that will provide meaningful data in the way of the stories of the experiences that you have in the system? No. So again, trying to equate the healthcare experience with the lessons learned from tourism is, I believe, a mismatch because there's just too many other variables involved. And certainly there is not the emotional or that human experience of the emotions of healthcare that go into tourism.
Right. No, it's really important. And even though that term medical tourism is used, it's about a different concept completely.
Absolutely.
Right.
Absolutely.
Yeah. Well,
Absolutely.
you also, there were many parts of telling your daughter's story that were really touching. They were deep. But one of the things that really stood out was about her liver doctor and how she would hold your hand, and that was not about consumerism, but as you say, a choice driven by humanity and compassion. This, I think, really speaks to the stark dramatic differences between the term. But another term I wanted to ask you about is about providers, which is the other side of this. It's a term I equally don't care for. You didn't write much about that, but I'm really interested to get your views. Should that term be used, provider?
You know, it's interesting because I believe in the article, I do reference care providers at one
Yeah,
point.
right.
And I will tell you that initially, when I started in this work, I always referred to physician, to nurses, to pharmacists, so on and so forth. And then as I continued on the journey in this work, all of a sudden that term provider got thrown into the mix. And I adapted it because it seemed that everyone was utilizing it to cover all the members of the care team that might interact or touch a patient. And so I will say I'm guilty of using that term. And I will say I got a lot of response from physicians and nurses, particularly physicians, about that term provider after my article came out, and how they also agree with you. They don't like that term. And I believe that term came about with this whole business imperative push in healthcare. And, you know, certainly insurance companies use that term, and healthcare systems have now adopted that term as well. And it probably is in play because of this whole consumerism push as well. I did used to prefer saying physicians or nurses or pharmacists, and that we're all part of the care team. That's the terminology I prefer. Just as I would rather be called a partner in my care versus a consumer or a customer. I think that the term does not fit the role that physicians and nurses play. They're not just a provider. I look at them as part of my team, and I'm on their team and they're on my team. And so we're all working together. And I'm not sure provider, I think, also gives a little bit of a hierarchy. It doesn't suggest that notion of that partnership, and it just reinforces that distance, which, if you think about it, if you're trying to move into consumerism is kind of defined by this transactional relationship. So you would use that term to reinforce that. So I see how it's developed, and I see how it's being pushed, and I think it's all related to this business, the business of medicine versus the actual human experience and the humanity of medicine.
Well, as you get to, I think, as we're, reviewing today about when healthcare was transformed to a business, these terms got adopted.
Right.
And now we're taking a relook at this.
Right.
And hopefully your work and your eloquence and what you continue to do as an advocate of patient care will help us get back on track. I mean, it's just one of many things we need to do. Another term you did bring up was about lean principles. And that would be interesting for you to just touch on as well.
Sure. So I've noticed in my work in healthcare thus far, there's a lot of frameworks that health systems are adopting, and one of which is becoming lean or utilizing lean principles. And, lean principles are really driven by efficiency and cost savings.
Right.
And typically those who advocate for lean principles within health systems say, well, this is going to benefit everyone, physicians, nurses,
right,
patients and their families and the communities we serve. But if you really dig down deep into that, I don't think it's trickled down at all to any cost savings for patients or families. I don't think it's improved quality for communities in which the healthcare system serves. And I certainly don't see physicians and nurses not being more burned out, more extended. They get affected by lean principles where, staffing is cut in
Hmm.
order for that cost savings to occur. They're being told to do 150 things versus 100 things a day. And so I'm not quite sure. I will tell you, when I first learned about lean and I read about it and I was being told about it, I was like, oh, this sounds great. And I read some books, but then when I got deeper into this work, I realized that, wait a minute, who is this benefiting other than the bottom line of healthcare systems?
Right.
And
Well,
so I think it's really interesting how, healthcare tends to cherry pick principles or terminology from other industries with the goal of trying to improve healthcare, when it's really not doing that. It's simply putting a band-aid on one problem and creating a new one.
well, what you're bringing up, and my sentiment is, we so largely lost the care of healthcare.
Yes.
And
Yes.
you referred to the care team, and you experienced that with your daughter, undoubtedly. And that is what we want to bring back. And hopefully, if we're more precise about language and avoid business terms, but we actually talk about, as you say, the clinicians, whether it's doctors and nurses, pharmacists, physical therapists, whoever it is, and be more specific than this provider term, which obviously could be a relative or a friend or
Right.
right? Now, the last thing I wanted to ask you was, this March essay that you wrote in Health Affairs. I wondered what you heard from that. What was it clearly resonated. When I posted it on Twitter, there was quite a bit of response. What has happened? What's been the response to you?
So I got an incredible response from the article, and I appreciate you tweeting and retweeting it, because a lot of people saw that from you and really reached out to me and started retweeting as well. And a number of people, sent me personal emails and messages, and I really was humbled by the response. I will say I was quite nervous to write the article I did, because in my work, there's kind of that fine line that you can only push the boundaries so far, and then if you push them too far, you get a lot of pushback. And I sometimes feel like I'm this one little patient advocate voice amongst all these other voices. And so I will say, physicians in particular, the article really resonated with them, and they really understood the story which I shared about my daughter's liver doctor. When we found out she was diagnosed with cancer, she asked to sit in the meeting with the oncologist, and she
Mm.
didn't have to do that, but she wanted to. And I said, of course you can join us. And in the meeting, she sat next to me and she held my hand the entire meeting. And every time they said something distressing, she would just squeeze my hand, but she didn't utter a word.
Right.
And I think that encapsulates the relationship that, patients and caregivers have with their physician or with their nurse. It's such a special bond. And I think that term consumer could never define that particular bond. And she would never look at us as a transactional relationship. And would consumer teach her to do that? No. As you said before, that's the humanity and compassion of medicine. And that's why most everyone comes into that profession, is really wanting to help humanity and give that empathy and compassion. So I
You
think
said,
that we have a lot to learn, and it's going to take many voices to speak up and push back against consumerism, because there's some pretty large organizations and groups that are trying to push consumerism and continue this business imperative of healthcare and that motivation by bottom lines. And I think we're going to get, or maybe we're already there, we're at a tipping point. And there's so much dissatisfaction. There's so many parts of the system that are broken. And to try and say, well, consumerism will give you more choices and you'll have shorter wait times and maybe you'll have price transparency, even though you still have to deal with your insurance provider or the lack thereof. I mean, it's, to me, I giggle and I'm like, that's not going to be the solution. And the only solution I see is that we really have to partner with one another and co-create solutions to improve healthcare as teams, equal voices at the table, and really begin this pushback. Because if we don't, I fear what's ahead, because I've already got a glimpse of it now, and I'm really nervous as to when my daughter slowly moves into adulthood, which she's almost there. These were the things I hoped that we would have conquered before she got to that point. And I see that a lot of this is just pushing us away from one another and distancing ourselves from one another. And that's not going to change healthcare.
Well, you said it so well, Hala. You know, I've been so eager to meet you since I read your work months ago, and I wanted the whole Medscape audience to get to know you, your story, because, you know, most of them are not on Twitter. Most of them don't read health affairs. The article wasn't open access. And for all these reasons, your story is so darn important. You convey it in a powerful way. I'm so glad to know that your daughter is okay, having gone through 16 years of a rough time, especially in her earlier years. And just want to carry on. You're just an important voice. You may qualify yourself as one, but it's a powerful one. And very few people have had an experience like you. You're in a rarefied group and can transmit the emotion, the sense of caring. And, you know, let's get these words right and let's zap consumer from the story of future healthcare. So thanks so much for joining us today on Medscape. And we'll look forward to following you and learning more from you in the future.
Thank you. And I look forward to partnering with your audience on improving healthcare and partnering with one another.
Terrific. Thanks a lot, Hala.
Thank you.